Hey everybody, thanks for sticking with us while we had a couple of technical glitches. At some point, eventually, we are not going to have any technical glitches. We are a little bit in the dark at the moment, just because we're putting all of our beautiful lights on Miss McKenna. And thank you very much for joining us, where today we have Miss Grainne McKenna, who is a consultant neurosurgeon at the Royal London Hospital. She specialises in neuro-oncology surgery and neurotrauma, and today she's going to be having a live Q A with us, talking through the theme of women in surgery, as well as a few tidbits about neurosurgery itself and in general. So without further ado, I'm just going to introduce you to Miss McKenna while we get the first questions ready.
Thank you so much, Alex, for inviting me to this live Q A for Brainbook. Always very happy to support the fantastic work you do with Brainbook. And I'm delighted to be talking about women in surgery today, and women in neurosurgery in particular. It is a little bit disappointing that we're still celebrating women in neurosurgery as a novelty, and I would rather be here talking about my subspecialty interests. But having experienced the challenges of neurosurgical training as a woman, I'm acutely aware that I need to do everything I can to inspire others and encourage others to follow in my footsteps if we're going to promote diversity in my workplace.
Perfect. So I think we can start with a really good question that came through about 11 minutes ago. So this is Anastamosis on Instagram, who says, what are people's reaction when you tell them you're a neurosurgeon?
Well, it depends on the context, but often people will say, oh, that's interesting. But mostly I tell people I'm a doctor if they ask me what I do. And if they pursue it, then I'll say I'm a surgeon, and then I'll tell them I'm a neurosurgeon. It always feels like dropping a bomb when you tell them you're a neurosurgeon, and it's quite unpredictable what question they're going to ask next.
Okay, fair enough. Right, so we've got quite a few quite deep questions, and I think maybe we should ease into them. So, when did you know that you wanted to be a neurosurgeon? Let's start at the very beginning.
I fell into neurosurgery a little bit by accident, to be honest. I think the moment when I knew for sure that I wanted to really be a neurosurgeon and take on the long haul that is neurosurgical training was when I completed the national selection process.
Okay.
So for those of you who aren't familiar with neurosurgical training, the recruitment of trainees after they've completed their foundation programme is via a national selection process, and it's an incredibly robust process and something that as a subspecialty we're very proud of, having this exceptionally high standard and exceptionally robust process of selecting people, and it feels like an intellectual assault course, this process. And at the end of it I thought, you know what, I don't know if I've got the job, but if I haven't, I'm going to try again, because this is what it's all about. And I thought the way they tested technical skills, clinical skills, judgment, communication skills, ethical dilemmas, made me realise that this is what I wanted to do.
Perfect. Avijit Mudgal is in India. He's a 15-year-old boy who wants to become a neurosurgeon one day. What message do you want to give to aspiring, in brackets, young people like me?
Neurosurgery is an incredible specialty. It's my job, and it's the most multifaceted career that I can imagine. I can't imagine another job that has this number of dimensions to it. The technical skill, the clinical judgment, the clinical skills, the getting to understand the brain and how it works, and going to work every day knowing that your goal is to save lives and improve the quality of people's lives, it is what gets me out of bed every morning, and I wouldn't do anything different, and I would encourage anyone to consider it as a career.
Brilliant. Shreya on Instagram asks, what are the obstacles you've faced and overcome on your journey to becoming a neurosurgeon? big question. We can tackle it.
So, if you embark on a career in surgery, and neurosurgery in particular, you're in it for the long haul. So it is the longest longest specialty training program. It takes a minimum of 10 years after medical school. It's a highly selective, highly competitive process, getting a neurosurgical training number, and so many potential applicants will have done additional degrees. The vast majority will have done intercalated BScs, BAs, master's degrees, higher degrees, PhDs before they even get to the point of applying. It can be grueling at times, being on call for sometimes 24 hours, being on call dealing with life-threatening emergencies at night, long operations, difficult decisions, difficult conversations. It's immensely challenging at every step along the way, but hugely rewarding. And I think the obstacles or the challenges are what makes it so rewarding. Knowing that you have taken responsibility for these challenges and overcome them is what the job's about.
Shreya on Instagram also asks, does being a woman really matter in the field of neurosurgery?
I would love to say no. But the facts speak for themselves. Somewhere between 7 and 10% of consultant neurosurgeons are women, which is much lower than the average for any surgical specialty, which is 11%. And so it's difficult to ignore those numbers. And I've sat in some committee meetings of neurosurgeons where I've been the only woman, or the second woman there as a trainee, for example, where there was one consultant female neurosurgeon. We've had these discussions. Is it important? Is it relevant that there aren't enough women? And I'd say absolutely yes. I remember having discussions during my time in this Neurosurgery Special Advisory Committee with the JCST, which is a panel that regulates neurosurgical training. And there was a discussion about how they were having difficulty recruiting any women to get involved in the examination processes and some of the national selection processes. And some people were asking that question, does it matter? And in fact, there have been occasions where the women in the group, hugely important in any workplace to have diversity. And as we're getting more and more women coming through, and in my experience working with women in other specialties, I see the richness of that diversity and what it brings to the table in terms of how we manage our patients and how we develop our services. And it can only be the right thing that the doctors caring for patients are representative of patients they're looking after.
Okay, thank you. Emily Gibbs on Instagram asks, in your opinion, what is the number one factor that deters women from surgery? What do you think the main factor is?
Well, neurosurgery is a very long training program, and as I said before, you require a lot of training before you go into neurosurgery. It's a competitive process, and it's another minimum of 8 years after that. On top of that, many neurosurgeons choose to do a PhD during their training program, or they take time out to pursue interest in developing their management skills, leadership skills, training in medical education, or they pursue post-training subspecialist fellowships. And these days, many people are accruing multiple fellowships in subspecialist areas to make sure that they can deliver when they take up a consultant job. And the trouble is, those peak years when you are acquiring all of those skills requires a huge investment of time. And that clashes with the time when many people will choose to have children. And I think it's this struggle between a work-life balance and juggling having children with neurosurgical training that is a deterrent to a lot of women. Now, of course, not all women want to have children or decide to have children or can have children. And it's this eternal dilemma about when's the best time to have children, whether that's before you start training, during training, at what stage during training, or finish your training. I mean, I am 36 and I haven't taken a great deal of time out. I've taken time out for both my children, but I haven't taken time out to do a higher degree. I've done a higher degree in medical education, which I chose to do part-time over the course of 3 years in addition to full-time training. And I would emphasise that my experience is just one experience. It was my decision about what worked best for me and my family during my training programme. And I think it's really important that women talk to other women who have done things different ways, because there are so many different examples for how you can make it work.
Sure.
Whether that's having children earlier in training, in the middle of training, choosing to power on through and finish your training, whether it's to work part-time. And I don't think we've fully harnessed all of those potential options in neurosurgical training. And I hope that will change in the future. So I, like many working mums, I'm sort of making things up as I go along.
Sure.
And trying to make things work. And this is what worked for me. So I chose to have my 2 children, or I was lucky enough to have my children when I was 30 and 33. And I chose to have my children once I had had enough experience of neurosurgery under my belt as a registrar on call, such that I felt I could come back into training with some confidence that I could get back up to speed very quickly. And then it's variable how much time people want to take out for their training, out for maternity leave from training. And I think it's really important to be flexible. It's difficult to know what to expect when you have your first child. Most people don't know what they've got in store.
Yeah. For anyone.
No, for anyone, exactly. And I had no clue what I was doing, or no clue how that would impact on my training, but I knew I wanted to have children. And I thought, look, let's go for it and see what happens. And I think it is a struggle. It's particularly a struggle coming back. As much as you're excited about coming back to work after having baby, it is hugely demanding, because you want people to take you seriously. You don't want to come back and people to assume that you're psychologically checked out.
Yeah.
And that's a learning curve for everyone on an individual basis. But I think the more women talk about their experiences and normalise the return to work, and talk about the barriers to making it work, the more likely we are to be able to address those barriers and make it work for women to have children at whatever stage they want to have children.
So while we're addressing the concept of barriers and tough concepts, Sheena Ali on YouTube sounds like she is in neurosurgery. I don't know at what level, but she says, I struggle every day with the so-called cliche of women can't be neurosurgeons. I never believed it until I became a neurosurgeon, in brackets. She asks, how did you deal with sexism and constant scrutiny, if indeed you had to deal with those things?
So, first of all, I haven't had a huge number of female role models in neurosurgery, but I've been lucky enough to work with one of the best neurosurgeons I've ever worked with, who was a woman. So Joan Grieve at Queen Square is absolutely top of her game.
Yeah.
I think is technically and clinically, and in terms of her communication skills, her leadership skills, management skills, hands down one of the all-round best surgeons I've worked with. And I was fortunate to work with her early in my career, and that dissolved any illusions I had about or any concerns I had about making this work. I thought, no, she's a woman, she's top of her game. I aspire to be a surgeon like her, and that gave me a great deal of confidence. So I think seeing women in the role is powerful. Women who you respect and who you see your colleagues respect, and your male contemporaries, their male consultant colleagues respecting, is a hugely powerful message.
Sure.
So I think getting access to those women is very important. How I deal with sexism, unfortunately, it exists. Of course it is. It exists. A few months ago I had even a patient who said, isn't there an older man who could do my operation, please? I decided to take that as a compliment because it may not last that long. But it can be difficult to respond to those types of scenarios, and I think there are lots of historical, cultural barriers sometimes to being a woman in neurosurgery. There was one conversation I had a few years ago with one of my male registrar colleagues. We were actually talking about just how good Miss Grainne was as a surgeon.
Both are off. We're on.
Good.
Your video settings have gone back on. Thanks.
Here we go. Focus and... Right. Just bear with us a moment, guys. Sorry about this. One of our... Yep. Okay. Happy? Good. We're back. Sorry about that, guys. Battery on the camera ran out. So we were talking about...
How, as a group of registrars, we were discussing whether a woman can be good at neurosurgery. And yeah, so I had one of my male colleagues saying, you know, she's good for a woman, implying that women can never be as good as men at neurosurgery.
That's
Then this is to my face, and his argument was that women have so much going on in their heads that they are unable to concentrate for long enough periods of time to be skull-based surgeons, for example,
Right.
involved in long surgical procedures.
Right.
And so the fact that these attitudes exist is just
It's
unacceptable.
unreal. Yeah. Yeah. I, for one, had my second child recently, and, you know, men are just as likely to have all the same stresses
Of
running in the
course.
background and be thinking about, you know, struggles at home and trying to raise a child and trying to balance work. So it's an absolutely preposterous thing to say. Thank you for answering that. It's a very difficult question to ask, especially in a public forum. Let's skip to a really interesting question from Auntie M Brain Tumours. She asks, and Auntie M is a lady who has had a brain tumour resected in the past herself. She's on Instagram. As a female, do you consider the impact of brain surgery on a female patient, or do you just see men and women as the same, knowing the problems they may have going forward? Interesting question.
Well, sometimes from a medical perspective it's relevant, especially dealing with, for example, with pituitary tumours or tumours that might require an adjuvant treatment like radiotherapy or chemotherapy, which can affect fertility. And that can affect men and women differently. And so sometimes from a medical perspective it's particularly relevant because it affects fertility. But in general, we have to consider who that person is, what their responsibilities are, what their occupation is, what what's important to them in life and what we want to get them back to, and how the pathology is affecting their quality of life, and what we can do to make things better for them.
Perfect, thank you. I hope that answers your question, Anna. Auntie M, sorry. Anastomosis on Instagram again. Here's another more clinical question. What's your favourite surgical procedure to perform?
Oh, there are so many.
Many.
I think one of the wonderful things about neurosurgical training is the breadth of different types of procedures that we do. There's so many different subspecialist fields: vascular, oncology, functional, complex spine, degenerative spine, intradural tumours. I think probably an intradural spinal tumour requires the most precise surgical skills. But I'm particularly enjoying my work in neuro-oncology at the moment. The sort of the intraoperative mapping, the precision of resecting cerebral cortex, but also skull base, manipulating cranial nerves, arachnoid dissection. I love my experiences working in vascular neurosurgery with Mr. Uff. Microsurgical skills are wonderful to develop, or being exposed to the inner workings of the human brain on a microscopic level is another world.
So essentially something as complex and difficult as possible.
But even the great thing about neurosurgery, it's not just these subspecialist areas that are so exciting, but the bread and butter of neurosurgery is incredibly rewarding. Last weekend we operated on a man with a foot drop, took out a big chunky disc under the microscope, and he's walking normally. So it's so rewarding to be able to use your technical skills to make someone better. Absolutely.
Gabriela Carboniero on Instagram has sent loads of questions. She obviously has a lot of questions she wanted to ask you. We'll choose a couple. How did you decide what branch within neurosurgery you wanted to work in?
I think it can be a little bit serendipitous, because it depends where the need is in your department at the time. I actually found it really difficult because I enjoyed all of the areas. For me personally, I was less interested in some of the functional neurosurgery, the placement of electrodes and so forth, because it involved less tissue handling, and I particularly enjoy the surgical aspect to my job.
Absolutely. Okay. So you touched on this in a previous question, but Emily Gibbs on Instagram again asks, how easy is it to manage wanting children and still wanting a surgical career? So I guess this question comes from the beginning of your journey in both aspects.
First of all, it is possible. I find it a little bit frustrating listening to some of the things that women in surgery and neurosurgery would say about how, I don't know what the fuss is about, women should just get on with it, we're doing it, you should be doing it too, because that fails to address the obvious barriers that there are. So for example, you often women, because women in surgery are more of a minority, there can sometimes be a sense of wanting to be a bit of a superhero, like, I'm amazing, I'm a surgeon and I'm a woman, and wow, I've got children, I'm doing it all, and I'm up looking after my children at night and going to work the next day, and aren't I amazing? And I would argue that that is impossible. But the only reason why I can do my job is because I rely on a small army of people looking after my children, and that for different people that will be a different group of people, but for me it's a nanny, and my husband, who does more than 50% of the childcare outside of what our nanny does, and also on grandparents who will come up for the weekend occasionally when we need help, when we're both working at the weekend.
So important.
So everyone has their own support network, but there's no way I could do this without having all of that support at home. And it's important to realise that you need to develop that support network when you go back to work with a child. And I would argue that the more support you have, the better, and it's an investment. So investing in the best quality childcare that you can have during those early years, to facilitate you doing your job and all of the extra things that you need to do towards the end of your neurosurgical training, in order to be competent and to be appointable as a consultant.
Perfect. Someone on Instagram has asked about me finding it hard to return to work and catch up after my second child. I will address that another time. We are with Grainne today. So, Miss McKenna, here's a more general question from a really interesting question from Taito on YouTube. I am someone very interested in preventative medicine, but I love surgery. How do you reconcile these two things in your practice, if you do reconcile them? Good question.
Preventative medicine in neurosurgery.
Yeah.
Well, it's a difficult one.
It is a difficult one. I think the only time that I can think of it is in spine clinics, when patients come with back or neck pain that you don't think is neuropathic in nature, and you try and give some advice about what they could do to prevent things worsening. I think that's the only...
We're doing a lot of work at the moment with our mild traumatic brain injury pathway. And traumatic brain injury affects vast numbers of patients, and even after minor knocks on the head or falls. And I think we're starting to understand a lot more about the types of problems that they're encountering further down the line after their head injury. And I think early intervention in the form of advising them about the types of symptoms they might experience, how it might impact their lives and their work and their relationships, and signposting them to where they can get support is important. And absolutely, with the degenerative spine patients who have neck pain and back pain, things like posture, exercise, building up core muscle strength are hugely important in preventing degeneration. So surgery is just is in some respects a small part of what we do. So much of it is counselling patients, and counselling patients about conservative management options, which in their own respect are preventative.
Lovely. Tonya F. Let's read this one. Have fellow female surgeons you've met or encountered been largely positive? Would you say there is benefit in prioritising having female mentors and colleagues when looking for jobs, etc.? Interesting.
What was the first part of that question?
Have fellow female surgeons you've met or encountered been largely positive? I mean, you mentioned Miss Grainne before,
Yes.
so that must have been a very positive. I suppose, is there a flip side to that coin? Have you met female surgeons that maybe haven't been so supportive?
I think in general, women are supportive of other women, but because of the numbers, women are often dependent on male mentors, and so in the most part, my key mentors were all men, and so I think you can look to men and women for mentorship, but I think in terms of understanding how to make things work on a personal level, if you're considering having children, it's really important to get the lowdown from women who have made it work in their own way, and to understand, maybe ask them to reflect on what they would have done differently, and what works and doesn't work so well for them. Perfect.
Chopping to Tori Robinson. Hi Tori, how are you? A more clinical question. How much time do you get to speak to patients before and after surgery, and do you think it is long enough?
A lot of our work is emergency work, and so often we're having conversations with patients in the emergency department or on the ward prior to their surgery. Sometimes the disease process may affect their conscious level or their ability to make a decision, and then in those scenarios we're having conversations with their families about making a best interest decision about how to proceed. For elective surgery, we see patients in the outpatient clinic at least once, usually twice, to discuss all of the various management options, the risks and benefits of all of those treatments. And it has to be enough time. If it's not enough time, we bring them back to clinic to see them again. Undertaking any kind of neurosurgical procedure is a major life decision. Yeah. It's a high stakes specialty, and there are always significant risks involved, and it's always very important that we take the time to manage patients' expectations about what we're trying to achieve with any surgical procedure.
Thank you. Back to Instagram. Oleyemix on IG asks, would you advise more women to go into this specialty?
Absolutely. I would love to have more female colleagues. I am hugely excited about the brilliant pipeline of neurosurgical female trainees that are coming along, and I think the future of neurosurgery as a more diverse specialty is very bright.
Perfect. Hero on Instagram asks, do you have any regrets in becoming a neurosurgeon?
No is the short answer, but there are days when I question all of my all of my life decisions.
Yep. Fine.
There are always horrendous days
Yeah.
when you think, oh my goodness, just sometimes buses come in threes or bad things come in threes, and you've had a horrendous night on call, and you might have had an unexpected problem with a patient, or and then you get home and you're exhausted and your children are running around with their pants on their heads, and you think, what am I doing? This is madness. And the next day you've got another challenging operation ahead. Sometimes it's quite full on.
Absolutely. Right. Speaking of full on, A. Matsadia on Instagram has asked quite a deep question, and feel free not to answer it if you think it's too personal. Does being a neurosurgeon affect your relationship with your partner negatively?
You would say yes. Yes,
Yes.
Definitely.
Yeah.
We don't tend to talk about the nitty-gritty of our jobs to each other very much. He is not a medic, which I think is a good thing. It's quite refreshing. I did show him one of your Brainbook videos recently, and he was absolutely horrified.
If they can have that effect.
I am lucky to have someone that I can depend on to pull their weight, and there's no doubt in my mind he does more than half of what I do, or the same as what I do and more in terms of looking after the children. And he's been hugely supportive at times when you think, why am I doing this? I've worked so many on calls and having to go above and beyond and do all of the extra work that you need to do as part of this career, and I certainly wouldn't be here without him.
Oh, lovely. I hope he sees that. Okay, Subhashri Hari on YouTube asks, what other interests do you have besides neurosurgery, and how important is it to have some other hobbies and interests?
I have no hobbies.
Yeah.
I am completely fulfilled doing neurosurgery full time and being a mum and seeing my family.
Yeah.
I feel complete with both of those. I would like to read more books. I do a little bit of gardening.
Ooh.
I deadhead a lot of geraniums.
Nice.
In my frustration. But no, I don't. I in the future I would like to pursue more hobbies. But honestly, at the moment, no, I am maxed out.
Cool. Tori on YouTube again asks, how much of your time is spent on annoying admin? Are you able to delegate this stuff to a team and focus the majority of your time on surgery and surgery prep? Yes.
I'd say most of the admin I do is quite important, and it's important that it's done by me and done well. So things like documenting difficult discussions, complex discussions with patients as part of summarising a clinical consultation. it can feel a little bit tedious and hard work, but it is important that it's done well, and I prefer to do that type of administration myself. So I don't feel overwhelmed by administration, no. I think all of the work that I do is important.
Tori also asks, is there mental health support for neurosurgeons? I can imagine that at times...
My family would talk about post-morteming, which is maybe a little bit, it sounds like an M&M debrief, but we like to analyse what's happened. We like to debrief on everything. And I think within the department I work in, we love to debrief as a group. So we like to whinge about our experiences dealing with other specialties, or we like to talk to each other about difficult experiences that we've had.
I can attest to that.
And I often think that the neurosurgery registrar's office is a little bit like a therapy room, because everyone gets everything off their chests. And when things go wrong, I think we talk very openly about what's happened and why did this happen and how we can make things better. And I think that's really healthy, and I encourage that.
Perfect. Very interesting question from Jeon Jungkook on YouTube. Sorry if I pronounced your name wrong. Is the undesired results of surgery harder to deal with for female neurosurgeons? For instance, if the patient is a child and the neurosurgeon is a mother.
I think that's difficult for anyone, but parents in particular will relate to the parents of the child.
Yeah.
So I did find some of the difficult clinical scenarios at Great Ormond Street particularly challenging as a parent, but I don't think that's unique to women.
Yeah, I think I can agree with you. We've had quite a lot of children coming through recently as emergencies, and I think when I didn't have children I found it quite difficult as a man, and now that I have 2 children I almost find it a bit harder, but not too much harder, because some of the coping mechanisms that we have as surgeons can sometimes be to try and shut off some of that, and desensitize. So sometimes you'll feel that a bit more afterwards, I think. But yeah, completely agree with you. Right, so I think we've got to the end of the YouTube questions, so we can go back to the Instagram questions that are still piling in. Tasmin, yeah, so I wanted to compare your experience with Miss McKenna's. So this was the question of me finding it hard to return to work and catch up after your second child. What do you think? And then I'll chip in with my thoughts after you.
It was much easier coming back to work after my second child because I knew what to expect. The first time I found immensely challenging because I didn't know how to make it work, and I would make ridiculous decisions. Like I thought that I would move the baby's schedule after my first baby's schedule to be really late at night so that I could go home late in the evening, and because I wanted to give my son his dinner and bath him and put him to bed, I would do all of this, and I would just have absolutely no time to even get enough rest. And so second time around it was a completely different story. We had a nanny and it was a tight ship, and I would come home and the children would have their dinner, be bathed, clean, ready for me to read them stories and put them to bed, and it's a completely different ball game second time around. So I was more than ready to come back to work after my second child.
I think my wife felt that way with our first, where I think having to just be with some baby, your child, that can't really talk back to you, you can't really interact with, and you might be at home with on your own for a while, can be very difficult. So you're kind of rare to go back to work. I think with our second child, I certainly found having a second child much more difficult. I think you have a lot more experience the second time round, so you feel like you can maybe get away with more, but then again you also feel that, you know, maybe you're not paying so much attention to your first child, and that you're doing a bit of an injustice to your second child. To be honest, it's just finding balance a lot of the time and just learning. You make up a lot of stuff as you go along, I feel.
In a strange sort of way, I find having 2 children, I am more relaxed about them spending, because they have each other for company. So I know that they're having fun playing together in my absence.
Fine. Tori asks, what do you do if a loved one refuses life-saving surgery for a family member, for example, a Jehovah's Witness? It's a difficult one, that.
Well, we have laws around these types of things, and if a patient does not have capacity to make their own decision, we act in their best interest, and usually we're heavily guided by the patient's relative or loved one, because they know the patient much better than we do, and if there are advanced directives that are legally binding, then that must be recognised.
Yeah.
But often in a life-saving situation, and it depends on the context, we will have to make a best interests decision.
Okay. Navleen on Instagram. What things can you do as a medical student to help with a career in neurosurgery? That's quite a broad question, and I think I will try and make a video of that moving forward. If you've got any tips that you felt really do help, or anything, or one major thing that you think is a really good thing to do, fire away. If not, we can leave it for another time.
I think if your medical school offers any kind of special study modules where you can go and work with the neurosurgical department, that is an absolutely fantastic opportunity, and we have several SSC students who are coming to be attached with us in the coming months, and we give them projects and they get a fantastic exposure to neurosurgery, so that would be amazing. If you don't have that type of opportunity, certainly elective opportunities are a good idea, or even contact your neurosurgical department and see what you can do.
Perfect. Nicola on YouTube. Hi Nicola. As a medical student, I and some of my female colleagues have experienced some resistance when highlighting we want to go into neurosurgery or surgery, particularly from older consultants. What's your advice for dealing with it, particularly from a medical student's point of view, and not letting the comments get to you?
You have to remember they're from a different generation, maybe more than one generation away, and of course we've all encountered people with those types of attitudes, but I would suggest that there's no place for those types of attitudes anymore, and you will have to develop a little bit of thick skin and come and talk to me.
Perfect. Lovely. Oh wow. Ezra, you are blocked. Right, now, unbelievable. There are some really, really odd people out there. So we've got loads of questions still on Instagram. We're trying to go through them in relative order. A lot of them kind of overlap with each other. Let's go to Sumejavilla on Instagram. I never know how to say people's tags. What's the longest operation you've ever done?
Oh goodness. Well, there's the operating time, but then there's the planning time and the setting up time, and I would say probably about 9 hours for a very large meningioma, probably.
Yeah, I think the longest that I've been in is about 9. Skull-based surgery,
Yes.
something like that. Yeah. You mentioned about, so MedB blog on Instagram asked about taking time out of training. Have you taken any time out of training, and what did you do? I think you touched upon this previously. And
I think that's a really good question. And upon reflection, I think the time out that I took to have my children was a really important time to reflect on my career and where I was going. And it can be difficult sometimes on the conveyor belt of neurosurgical training to get perspective on all of that. And I've really encouraged the trainees that I've mentored to take time out for any reason to get that time and space to reflect on where you're going. When you're in the thick of neurosurgical training, you go from on-call to clinic to preparing for your next list, and then a weekend on-call, and then you're sort of crashing and burning and getting some rest. And it can be easy to lose sight of the bigger picture of where you're going and what you're trying to achieve and what subspecialty interest you're developing, and are you, for want of a better word, ticking all of the other boxes to make sure that you're a well-rounded trainee who's going to be appointable as a consultant. And it's important that you are multifaceted as a finished trainee, and that you can bring specialist skills to whatever job you take up. And that might be management, leadership, research, or education. And I'm really encouraged, for example, by the current cohort at the Royal London, where we have one registrar going off to do research, one yourself specialising in education, and another specialising in management and working part-time. I think it's phenomenal to see 3 men go and change the narrative of neurosurgical training by working part-time and doing those things.
Yeah.
And I think that will be hugely empowering for women who want to do the same and have children or do any of those things.
Absolutely. Lovely. Christian Murray, so I'm a dude and I want to go into neurosurgery, any advice? It's a broad question. If you can maybe narrow it down to certain things that you would like to know about. Also, we're getting a lot of spam from some rather horrid people, so sorry if I keep having to cut out. Right, Taito Onyekweli. Have you been following brain-machine interfaces, aka neural link? If so, are you excited for future applications?
The field of neurosurgery and neuroscience is constantly evolving, which is one of the attractions of this specialty, because you're always at the cutting edge of understanding how the brain works and how we interact with it from a surgical perspective. And I absolutely see a role for brain-computer interfaces. I mean, we're already doing things like this, like cochlear implants, and there are retinal implants and all sorts of new concepts that are being developed. And who knows, by the time I finish my career, we might be implanting devices in the brain. But I think you have to be prepared to innovate and diversify and embrace new technologies and new ideas. And I don't think the neurosurgeon that I start off being will be the same towards the end of my career.
Yeah, absolutely. Yeah, Catherine, I completely agree with you. So, Tonya F., did you find any change to your colleagues' approach to you when you returned to work after having your children?
When I returned after my having my first child, unfortunately, none of my contemporaries at the time had children. And so I found it difficult to talk to them about. I didn't talk about it. I just came and did my job and went home again and tried to make it work. And so I really struggled and found that difficult, and I tried to hide the fact that I was struggling with that. Whereas second time round, I was a lot more confident and comfortable with the fact that I had children, and was balancing that with work. And perhaps it was more my attitude that had changed rather than other people's attitude. But when you come to work, people expect you to come and do your job and to be there 100% focused on what you're doing all of the time. And I would expect that of my colleagues.
Cool, lovely. Ahmed Suleiman, again, that's a broad question about studying at the age of 14 to become an orthopaedic spine surgeon. It definitely depends on where you are based in the world and what your curriculum requirements are to get into medicine in general. So I would look into what your local kind of procedures are for getting into medicine. Now, Denise asks, Denise W on YouTube, have you ever had to decline doing surgery on someone because the tumour was too big and the risk for the patient was too high?
Yes.
Yeah.
particularly in very elderly patients with multiple medical comorbidities. And sometimes we're guided by the anaesthetist when they say that the anaesthetic risk of mortality and morbidity is...
They've dropped us.
YouTube technical glitch.
We've just lost all that. Hold on. Hello. What happened there? We just lost loads of views. Fine. It's okay. It's the last few questions anyway. We've got about 8 minutes. So,
Okay.
so you were talking about So you're talking about the med ed qualification part time.
Yes. So I could have done it part time. I could have worked part time, but it was my personal decision to power on through training, to keep the momentum of training, and to try to finish it as soon as possible. So that was my own personal strategy, but other people will do things differently, and it doesn't mean that my way is the right way. But it worked for me. I say it worked for me. I have to say it was a pretty brutal few years.
Yeah.
Coming back from having a second baby,
Yeah.
doing fellowship exams,
Yeah.
which are really full on, 6 months of preparation,
Oh.
and doing a part-time master's was
Can't
probably the nadir of my training. So things could only get better after that.
Absolutely. Yeah, I've got all of that to look forward to. I'll be doing my master's last year at the same time as the FRCS, when my second child will be walking as well. So loads of fun.
But it is difficult because you come back and it's full on doing
Yeah.
full-time neurosurgery.
Yeah.
And
You know,
keeping
your master's on top.
keeping your head above water
Yeah,
at
yeah.
home and seeing your children, etc.
Absolutely.
But then for people to say to you, well, you know, what else can you offer? You're just a full-time neurosurgeon specialising in these things. You know, what else can you bring to the table?
Yeah.
It feels like sometimes it's never enough.
D. Pereira, I think that's Duranka. When it comes to leading your team and gaining the skills to do so, what is the best advice you could give to interested juniors in terms of building their own skill sets?
That's a really good question. And I am just at the beginning of my consultant career, and I hope that my leadership and management skills will evolve and will improve over time. I think the most important thing is to listen, to observe how other people do things, and to reflect on how they do things and what you might do differently. So to acknowledge and to identify those behaviours and attitudes and strategies that people use that you think are effective, that you would like to adopt, and some of those that don't seem to be to work very well. So you can learn so much from observing others as long as you actively reflect on those experiences. And that applies to virtually all of neurosurgery in every dimension of neurosurgery, but particularly those leadership skills.
Perfect. Gideon asks, how have your first few weeks as a consultant been? Have there been any particular challenges other than me being your registrar on call?
Recovered from that.
Yeah.
Well, I've been incredibly fortunate because I had an opportunity to act up as a consultant for 9 months towards the end of my neurosurgical training. And so it was a very natural transition to being in a formal consultant post. I have a fantastic support network of consultants and registrars. I have a really inspiring group of professionals that I work with across the various subspecialties in the hospital. I have to say, moving into the broom cupboard, which is the consultant's office, was a big transition. But I now have the key to the broom cupboard. So that's all my life goals are achieved.
Brilliant. There was a really good question earlier about from Kate McConnell, which I'll ask again because I think we dropped the connection.
Oh.
Was it hard operating on paediatric patients after you've had children? Maybe
It is, to begin with, just as many operations can be challenging psychologically to begin with, but you get used to them and it becomes normal for you.
Perfect. Crazy for Petsco UK, thank you. How long does it take you to wind down after surgery? With the level of concentration required, are you able to relax enough to make sure you can make sure to put your health first too?
Well, when you're operating, you are completely in the zone. You can't think about anything else until the microsurgical stage is over, or the key stage of the operation is over. And then you go into more of an autopilot, doing the simpler things like the closing, etc., and getting the patient off the table safely. And then there's a natural break where you're writing up notes or labeling specimens and all those basic things whilst you're waiting for the patient to wake up. And then there's sort of a relaxed time until you go and assess your patient when they've woken up from their anaesthetic. So there is that natural wind down process, and if the patient's woken up, then you and everything is fine, then you have an instant relief that everything's gone smoothly.
Yeah.
And then you can start to think about something else.
Perfect. I don't know whether this is going over the same thing again, but let's see. Jaden Gittens on Instagram. Many focus on the negatives, but what are the positives of being a female neurosurgeon? Specifically.
The positives.
Well,
I would argue that they're the same as they are for men.
I would say Grania is a lot more organised than all of us boys put together.
Yeah. I was called Mum as the senior registrar, and now I'm called Boss.
Yeah, boss lady. Okay, so there aren't many more questions. If someone wants to pop a last question on YouTube, Nicola did send a few more through by text. Let's see. I sent them to you before. I think we've answered most of it, to be honest. How do you remain resilient in the face of setbacks? From Nicola.
By striving to do things better. I think there's always something to be learned from anything that doesn't go according to plan. I think it is good to own. It's important that to feel bad about things when they go wrong, or certainly to acknowledge that it's a negative thing. But I think that is positive if it's used constructively, but you can't let it get to you personally, to the point where you lose your nerve or lose the ability to engage with that process and make things better.
Lovely. So here are the last two questions from Wissal and Archangel 1996J. So Wissal says, in fact, they're both a very similar question. Wissal asks, what are the skills essential for becoming a surgeon? Archangel asks, what do you think are essential traits for a neurosurgeon?
Those are also very good questions. If I look at my consultant colleagues, they're all very different individuals and very different surgeons. They do things differently. So there's no magic recipe for the perfect surgeon. And I think the diversity of those individuals brings great strength, and that's where I think it's also important to have more women and have an equal balance of women in the long term. I would suggest that being well-rounded is very important. I would say perhaps the common theme amongst all of my neurosurgical colleagues is that they are people who tend to be good at lots of things. They're not just someone who's good at exams, although they're all good at exams, but they're also have excellent manual dexterity, and they are good communicators, and they have lots of common sense. And being well-rounded is hugely important, and I think sometimes our education system fails students. And I look back at my own education and training, and it was very focused on sciences and maths, and this was the magic recipe to being a doctor, was doing 5 A-levels in sciences and maths, which is ridiculous, really. It's a foundation, but it's not well-rounded.
Yeah.
and for my own children, I think it's very important that they have an exposure to humanities at an advanced level, and as well as sciences and maths and the arts and all of that. And so I think I would encourage medical students or aspiring medical students to focus on being well-rounded.
Yeah. There is one more question, if you're happy to answer it. I think it's an important one. So Tibalenge Fwati asks, when I was on work experience, I fainted quite a bit in theatre. What would you say to young people who may be put off of doing medicine or going into surgery due to feeling squeamish?
Also a really good question. I was exactly the same. I really didn't enjoy anatomy dissection. I was not one of those people who was born to be a surgeon. I found the whole process of operating on dead bodies really disgusting.
Right.
It's a totally different. I mean, I have huge respect for patients who donate their bodies to medical research and enable that process. For me, it wasn't. It didn't. I don't enjoy cadaveric dissection at all. And I spent most of my medical school anatomy dissection classes in the locker rooms on the floor, feeling ill,
right.
If that makes you feel any better. And this is the truth, my friends will all testify to this.
Yeah.
And equally, when I first did my elective in general surgery, when you're assisting, it's incredibly dull. If you don't have responsibility for the surgical procedure, watching other people, as I'm sure you will know, sitting hours down the microscope can be terribly vasovagal inducing. Do not let that put you off. I would encourage you all to do some suturing, do some basic surgical skills, and you will know early on whether or not you're going to get that surgical bug. To want to keep going.
Happy for one more? There's quite a few people asking questions. One more? One more question? Yeah, one more. Farai Chawira, this is the last question. What's your experience been like working with medical associate professionals such as physician associates?
Phenomenally good. And we've been so fortunate at the Royal London to have 3 neurosurgical physicians associates, which is a new group of allied health professionals, and they're an incredible asset to our department, and I have nothing but positive things to say about them.
Brilliant. Thank you so much for your time. I hope everybody enjoyed that, and I gather you might be on call this weekend, so good luck, and I hope you have an excellent weekend.
Thank you all.
And thank you so much for giving us your time.
You're very
because
welcome.
It's very, very valuable.
Thank you.
All right. Thank you.